Well, a good morning and thanks for waking up to Sunrise at Sea. My name is Kieran Atozo, and today, once again, we are at the Medical Hub, and today we're going to be talking to a pediatrician, and that's someone that specializes in kids. COVID has been around for quite some time now. Yeah, it's 2 years, and schools are reopening as of next month. And we're wondering, how can we go about this situation? What are some of the tips you can actually advise mothers, children? So if you just tuned in, I'm joined by Mr. Adoga Innocent. He's a PD. Good morning, sir.
Good morning.
How are you?
Very well.
I can see that.
Yeah, it's a pleasure.
Yes, so just a quick start to pick up really fast. In summary, how can you really explain what a pediatrician actually does?
Okay, thank you. That's a very important question.
Yes.
Yeah, in the medical field, we have specialists of various sorts. One who has trained to become a medical doctor would have to go through some basic training. That, of course, would take about 5 to 6 years, and thereafter, such a person becomes a doctor. That is the most basic level of training.
Yeah.
Some other people would want to go further to specialize or sub-specialize, so to say. By that I mean, having become a doctor, you know so much of virtually everything, but again,
Yes.
you want to get committed towards a particular aspect of medical training. And so for the pediatricians, they go ahead to train to cater for children in depth.
Yeah.
And so for most institutions, it takes about 3 to 6 years roughly. You get trained how to handle children. It's actually a very large scope. Of course, when we talk children, in some climes you talk about young people up to the age of 17, some will say 15.
Oh, I was actually about to ask.
Yeah,
the
from
age
birth up till say 17 in
years.
some settings, and some will say okay 15, some will say 12. So that is what a pediatrician is trained to do, to cater for kids, those who are sick and even those who are well though. So to ensure that they maintain their health.
All right. So what are some of the services you actually do here
Okay, well,
for the children?
for the children,
Yes.
yes, here at the Medical Hub, we have quite a plethora of services we offer children. I want to start from the outset, you know. It's important to note that pediatricians essentially work along with the gynecologists and obstetricians.
Sorry, what?
The gynecologists,
The gynecologists.
and the obstetricians.
Okay.
These are doctors who also have gone to specialize taking care of women, pregnant women and their babies. And so
Yeah.
you discover that the coming of a baby has something to do with the mother who is pregnant. So that's the reason why the pediatricians cannot but work very closely with the obstetrician and gynecologist. So if I want to go that route, I would say, okay, yes, we offer neonatal services. By that I mean newborns. These are children, of course, who are spending or who have just lived within the first 28 days of life. Yeah, from birth.
Less than a month.
So, yeah, less than a month. And of course, we have other children, older children, and
Yeah.
even adolescents. Yeah. So that we offer neonatal care. In fact, we have a neonatal intensive care unit here, where children who are born with issues, problems during birth, or those who develop problems thereafter after birth, we keep them at the neonatal intensive care unit. And of course, as pediatricians, we cater for them whole range of
Yeah.
possible problems with the newborns. So that we offer.
You're talking
Yeah.
of problems and conditions. What are some of those conditions that you tend to face?
Okay, before I talk
The
about,
kids, yeah.
thank you very much. That's very important a question. Before I talk about other services we offer, I quickly want to again go a little in depth as it relates to the neonatal care. Yeah, some children are born and they have problem with breathing.
Yeah.
Yeah, so That's, of course, we mean that they will need some respiratory support, breathing support, so to speak, simple terms. So we also have facilities. We have what we call the neonatal continuous positive airway pressure. That's a kind of machine that helps the babies to be able to maintain oxygen. And when we talk about issues with breathing, respiration, there are a myriad of causes, right? But importantly, I will not fail to mention that there are children who also have been born too soon.
Premature babies.
Premature babies, they call them. We call them, preterm babies.
Preterm.
Yeah, just about 3 weeks, barely 3 weeks ago, we celebrated the World Prematurity Day on the 17th of November.
Oh, happy birthday to that baby.
So, children who are born too early, too soon, premature babies, of course, they would have to stay in the nursery, in the neonatal intensive care unit for a while we fathom how they will be able to live, independently. Yeah. Now they are outside their mother's womb. They depended upon the placenta that connected them with their mothers, but of course, they have not fully had their organs developed before they were born. That's why we say they're born too soon, and some are also born too sick. And so they have to stay in the neonatal intensive care unit, catered for. They get into the incubator, so their temperature is well taken care of, and then their breathing, is supported. And so after a few days or weeks, when they would have been able to live independent lives, then we let them go while we follow them up closely, the clinic.
That's amazing. Now, just a quick one. I want to ask, COVID is coming. Okay, we're still in the COVID period. It's 2 years now, and kids are soon going back to school. In fact, next month, kids are going to be going back to school. So some mothers have actually given birth COVID. They're calling them COVID babies.
I see.
Yes. So what's that advice, that you would actually give a parent who's preparing their kid to go back to school, and a newly born baby or a mother who just gave birth, since you actually take care of kids from the age of newly born to 17, 15 years of age? Yeah.
Okay, that's a very important question. Of course, we're in the COVID era. And this is new to everyone. Again, here in this part of the world, we still have a few countries whose children are still back at home. And in our immediate community, we are preparing to send our kids back to school in January. As I said, it's a tough one, but looking at it from the medical angle, I would say, of course, not so much have been known about COVID in children, even though there are some studies that have been done. COVID actually has its toll more in the adults and the elderly. So that's why it is a tough one, as I said. But again, the basic precautions, okay? Of course, I want to believe that kids who will be going back to school should be kids who, I guess, a little older. For me, I would think, of course, these kids should get some, what I would call a kind of home tutelage, of course. We know that COVID is transmitted through a kind of contact, so not really contact, so to say, but of course respiratory droplets, cough, sneezing, and all of that. So we need to educate them from home. We don't just leave everything to the teachers, the Ministry of Education or Ministry of Health. By that I mean, as mothers, of course, we've had various education about COVID for 2 years now. So we have to speak to our wards and our kids that when they cough, it's a reflex. Sometimes you can't stop that. Let them cough, with their hand, their elbow, covering up their mouths and their nostrils. And I would advise that I think kids should have some kind of handkerchiefs or so. That will also help. Okay, and then the kids, of course, they are intelligent people. We can tell them contact should still be reduced, as much as possible. The hugging of their other, classmates, playmates should be reduced, essentially. So, as I said, it's a new thing. I think as kids have been home for close to 2 years, we just have to take them back to school. And then the teachers also have their part to play, trying to they kind of moderate the situation and they guide the children. Um, of course, one day at a time, we'll see how we progress.
Yes.
Yeah. So
and as a pediatrician, like I say, the mothers.
Yep.
Yeah, there's so many mothers out there. What advice would you give a mother to look out for a kid who's 2 months, 3 months, a couple of months old? What are some of those things they should actually look out for?
Okay, thank you.
Because so many kids can actually be, a kid can be sick, and we don't know. Maybe they're crying so much and you think they're hungry. So what are some of those things that a mother should actually look out for?
Okay, so thank you again for that question. Yeah, we have mothers who are experienced.
Mothers?
Yes.
Right.
What I mean experience, of course, they've had some kids, they've had contact with the pediatricians in the past, and they know some things that could be causing what's in a child who is kind of fuzzy and just cried a lot. So, but again, we also have mothers who are inexperienced. But again, I understand your question. For children who are much younger, when they cry, it is either they have pain, they are hungry, they don't have sufficient sleep, you know, or they are just being frightened by the situation around, okay? So it depends on the context, actually. But when a baby begins to cry, younger children cry excessively and persistently, there is something wrong. A baby who is hungry, of course, and the only way the baby will speak is, I'm hungry, I have to make it known, and then they cry. So once you feed that child and the child is filled, he or she will stop crying, right? Yeah. But if that baby continuously cries, then I think that's when you should begin to seek medical care. Yeah, so, but there are other things like fever. When I mean fever, I mean hotness of the body. Sometimes some kids get this high temperature and they even convulse, what we call febrile convulsion. And so convulsion is really feared, even by parents and medical personnel alike, because it has to do with the brain, so to speak. So a child who has high fever, the temperature is so high, particularly at night, and you can't just get to the hospital in good time, you should give what we call antipyretic, something that brings down the temperature. We have all of those. They are very common in our households. We talk about paracetamol. It's an antipyretic, so it helps to bring down the temperature. Sometimes just to open up the child's clothing, okay? And that reduces the temperature. And sometimes even fanning, okay? And there's what we call tepid sponging. Use lukewarm water, okay? A child whose fever, hotness of the body, or high temperature, as we know it is so high, you just put in some water, cold and warm water in between, tepid. And so you use it on that child, not very cold water, not very warm water. And so once you do that, the temperature comes down, and then after that you can come seek medical care. Because when the temperature is so very high, sometimes the baby could convulse. Yeah, I mean have seizures, so to speak. Yep.
Wow, I didn't know that. I didn't know that. Is there anything else that you think we should add on?
Yes, please. Thank you so very much for coming. I remember we started off with the services that we provide at the medical hub.
Yes.
I've talked about the neonatal care services that we offer. We also offer clinic services. Just right now, I'm the clinic. I've sat here since morning, and the mothers come with children who have various disease conditions, ranging from malaria, from infection of the urine, we call urinary tract infection, and some other infections. Of course, we offer that. So you bring your kids, we see them, we examine them, we interact with them, and sometimes we also order some investigations that would help us to know what exactly the problems are, and then we treat them appropriately. Well,
that's all we had for you today morning, and like I say, Dr. Adonga did share quite some insightful information, and I hope the mothers out there that are actually watching, and fathers had to got one or two things from what she said. So yeah, COVID is actually still there. Do sanitize, wear your mask, be cautious of the places you go to, the people you meet. Well, that's all we had for you here in Sunrise at Sea. good morning once again, and thank you, doctor.
Thank you for having
Yes.
me, please. Thank you.
Well, that's a wrap. Good morning.